What happens when someone who drank alcohol for years suddenly stops? Deep inside the brain, a dangerous biological storm begins to gather. To understand why this is a medical emergency, we must look at how the brain adapts to chronic alcohol use. Alcohol is a central nervous system depressant. It works by enhancing the brain's primary inhibitory neurotransmitter, GABA. Over years of heavy drinking, the brain adapts to alcohol's constant presence by reducing its own natural calming sensitivity. It develops a new, fragile equilibrium, one that becomes entirely dependent on alcohol just to maintain basic function. The brain becomes chemically dependent on alcohol just to feel normal, losing its ability to regulate itself. But when alcohol suddenly disappears, the brain is caught without its chemical brakes. Without alcohol's suppressive effect, the excitatory systems take over, sending the nervous system into overdrive. The body enters withdrawal, the autonomic nervous system becomes dangerously overactive. Heart rate climbs, blood pressure spikes, and the body begins to sweat profusely as the system panics. These early symptoms are just the beginning of a complex physiological cascade. As withdrawal progresses, the brain becomes increasingly unstable, firing signals without coordination. In some cases, this electrical instability can trigger grand mal seizures, a sudden, life-threatening disruption. This is not just physical discomfort, it is a profound malfunction of the brain's hardware. As withdrawal worsens, the mental state begins to deteriorate. Some develop terrifying hallucinations. The brain can no longer distinguish between reality and internal electrical noise. These symptoms signal that the brain's core stability is failing. The most dangerous stage is delirium tremens. This is a profound medical emergency. It is characterized by severe agitation, confusion, and cardiovascular collapse. Without treatment, it can be fatal. This is why professional medical supervision is mandatory for heavy drinkers attempting to stop. Doctors use medications called benzodiazepines to act as temporary brakes for the overactive brain. They administer thiamine to prevent permanent brain damage and closely monitor electrolyte levels. Medical professionals are there to prevent the heart and brain from failing during this critical transition. If treated safely, the brain slowly begins the long process of healing and recalibrating. Recovery is not a sign of weakness. It is the human body fighting its way back to life. It is a scientific process of restoration that requires patience, support, and specialized care. Never stop heavy alcohol use suddenly without medical supervision. The risk is simply too high. Talk to a doctor. Seek professional help. There is a safe way forward. Your brain can heal, but first, you have to survive the storm.